So I'd like to invite up our final speaker, Louise Hansford, who many of you will know Louise. She's been involved in INSU for a number of years. She has over 20 years experience, she told me earlier, in the substance use sector and is the Hepatitis C Elimination Coordinator for the Hep See You Later, which she's got lots of badges, I believe, if you want one, in Lincolnshire, United Kingdom. She's a member of the INSU board and the community committee, and has also recently completed a Masters in Public Health from Bournemouth University. And I wanted to ad lib and say Louise has been a great supporter of our EMCR group. So yeah, thank you. I'm really glad to have you here to wrap up our, and we're going to have a Q&A at the end, by the way, and panel discussion. But yeah, thanks, Louise. Hopefully.
Yes.
There we go.
So I don't really need to introduce myself after that, do I? Thank you, Brendan.
No.
I would just like to have a show of hands. How many of you have got a poster in the back of your cupboards or in your offices or somewhere that has come back from a conference with you? Brilliant. So the problem with going last after such an esteemed panel is pretty much everything that I would have said has been said. So what I wanted to do is just give you a few examples. So as Brendan said, I'm somebody that identifies as a member of the community. I'm also somebody that feels passionate about the people we serve and about research and about research being meaningful. Oh, you shouldn't give me one of these.
The big one. The big one.
Oh, okay. So I just want to give you a couple of examples. So this is our poster. I couldn't make it bigger on the slide, but and I haven't got a pointy thing, which is a shame, but I'm going to just come and point. So this is a poster that was a Gilead Fellowship funded project in a rural community. So there was about 40 people that we knew of that had Hep C. The trip to the hospital was, and I'm talking UK miles, sorry, I don't do kilometres. It was a 72 to 78 mile round trip. It took about 3.5 hours if you could do it, which ruled out anybody that had children at school. It was not possible to go from Andover to Southampton and get back to pick your kids up from school. So it was the only part, I at the time I was working for a service in Hampshire, it was the only hub out of 9 hubs that was just failing people left, right and centre in Hep C. So we got this project, Accessing the Inaccessible, and we decided, because the people that we were trying to reach had multiple inequalities, really areas of deprivation. You know, when you talk about the social determinants of health, these guys were hitting like multiple areas: lack of housing, lack of education, you know, pretty much everything. So it was a really united group. So what we decided to do is kind of treat people in cohorts, and back in 2017 in the UK, you could only treat a certain amount of people per month with DAAs. So we had a real opportunity to just get it right. So I'm going to talk particularly about Fred and Mavis. So Fred and Mavis were a couple, long term, had Hep C probably 10, 15 years, and we wanted to get them both on treatment. Well, Fred said that he would only come forward for treatment once Mavis had done it and she'd got through it, and he was so sceptical. A lot of them had been offered interferon, had tried interferon, you know. So we got Mavis free treatment. We got 6-7 people that were really influential in the peer group to kind of go first, if you like. We had one guy that thought he was going to get pink spots and grow an extra testicle. I don't know. I genuinely don't know if he was relieved or disappointed when that happened. But so what I would say about how we did this project was it was really involving everybody. And originally there were, I think somebody talked, like we hear a lot about it in conferences with vans or with clinics, by default you can break somebody's confidentiality if they're coming to a service when there's somebody to do a Hep C intervention. This honestly, this project and the outcomes from it just give me goosebumps, because they all just came together. They, you know, the pharmacists, everybody in the little town of Andover got involved. Back to Fred and Mavis. So Mavis did the treatment. She got her SVR. We talked to Fred. He was like, oh, no, I've got these blinding headaches. I need to get them sorted. So this went on. Fred, come on. Like, oh, no, I've something else. And I got to the point, like 18 months in, where I wrote him a letter and just said, look, I know it's not a priority for you now, but the hepatology nurses aren't going to be able to come back out to the community for one or two people. So, and then he told the prescribing doctor for Louise to leave him alone. So I took a complete step back. Forward wind to INSHOE in Montreal, where we presented this poster. What you can't see very well here is next to the 1st of September, it says one person left to treat. So I left Montreal. I had a big argument with an airport official that wasn't going to let me take my poster home and wanted to charge me, I don't know, £80–90 to take it home. I could get a new poster printed out for less than that. So I was like wandering around, like I walk with a stick, wandering around looking for somewhere to dispose of this poster, and another airport official obviously thought I was a damsel in distress and waved me through. So I got this poster. So then I had this dilemma, what do I do with this poster? So I took this poster back to the people who the poster was about, and I put it on the wall in reception. Now this is like nearly 2 years on, and Fred still hasn't been treated. So Fred comes in, looks at this poster and says to Amy, our receptionist, so if you ever think that there's people that can get involved in Hep C elimination and people that can't, please, I urge you to think again. 3 to 5 years of interventions with Fred, and it was a conversation with our receptionist that turned it around. So Fred looked at this and he went, Amy, who's that one? She went, well, that's you, Fred. Oh, you've broken my confidence. She went, no, you haven't. It just says one left to treat. He went, right, book me in to see that Louise. So I went in, all G'd up for another motivational interviewing, another, my whole tool case of empowerment. He went, walked in, he went, book me in for the hepatology nurses. I went, okay, still a bit like, wow. On the day that Fred started treatment, we went in and we said to Fred, do we need to talk about some graffiti? Now,
So
and
funny.
the reason I share this, and I'll just come on to another poster to finish, do you know, who would have known that just by taking that poster back to the people it was about, one person left to treat, you know, and this was what turned it around. You know, as Brendan said, I recently did my masters. You know, we've all got smartphones. You know, we can all open a PDF poster on a smartphone. Every one of the people I interviewed got that poster. Every one of the people that I interviewed shared that poster with their loved ones, their family, their friends. Every one of them come back and said to me, thank you so much. You know, I know what your conclusions were. I know how you felt valued. My research wasn't particularly, it was a little bit contentious, because obviously you can see the title. it was about how, like, when I had interferon, you had to be 2 years drug-free to get interferon. You know, we've in the UK, we've gone, no, you can't have drug treatment. You can't have DAAs, you're using. No, you can't, you're drinking. No, you can't, you're going to prison. No, you can't, you're still injecting. To, on the same day, going, you're Hep C positive, have some drugs. You know, and actually, the voices of these guys, when I reflected that back all round to various nurses, to hepatologists, and said, look, we just need to take a step back and think about this. You know, I could tell you about 50 to 60 people who we've tried to treat with DAAs that really didn't want to take them. You know, so, you know, I think for me, these are my suggestions. Ask participants at your earliest point, you know, say to them, how would you like to hear about my research? Would you like to hear about my research? I've been involved in lots of research projects and then been given a 10,000 to 100,000 word document to read. I can't even, Google Translate doesn't even understand some of the academic terms. You know, so it's, but also don't make assumptions. You know, like I've had such a diverse experience with like 18-year-olds up to the eldest person I work with in a substance misuse capacity was 82. You know, offer different mediums. Not everybody has access to technology. They don't. And you know, you said we did format sharing back. You know, people like to know that their voice has been heard. They like to know what's changed, and they like to be involved. You know, there's an awful. I'm a peer reviewer for NIHR, so I see a lot of grant applications and research proposals that the patient involvement feels quite tokenistic and tick boxy. You know, ask people. Everybody likes to be asked and heard. And I'll leave it there. Thanks.
Can you? No? Yes. I said I'm not standing now. It's 5:15. Thank you so much, Louise. And what resonates with me is people don't have technology. I know, especially in my setting, phones are the first thing to go. It's just not a luxury everybody can have. So I think we're going to open it up for some Q&A, if there's any questions from the audience.